Now we did it, pranayama studies on patients in a yoga institute in Bombay, and we found that all parameters of heart's function improve with 4-vessel coronary artery disease who were told in the hospital that without bypass surgery they'll die in 3 months. They're all alive 5 years later, and not only that, their hearts are absolutely normal now. So we did this study and followed it up and showed that it really works even with the conventional reductionist parameters. Now, modern medicine has failed and failed miserably. I will show you only a few things. The Institute of Medicine report in the United States of America said that the first cause of death in the United States of America is heart attack. Second, cancer. Third, doctors and hospitals. And fourth, the adverse drug reactions of the drugs that doctors prescribe. Fifth, then stroke, and so on and so forth. And in this country with 250 million people, on an average 350,000 people die annually because of doctors' interventions and the drug interactions. Now, the third thing, doctors went on strike in Israel a couple of years ago for 3 months. They were not working at all, and there were no private doctors in Israel. And then, of course, somebody brokered peace between the government and the doctors, and they came back. And when they came back, audit showed the death rate had fallen precipitously in every city during the strike period, only to come up to its original level, overshoot it when they came back to work. And do you know who brokered peace? Can you guess? Morticians brokered peace. Their coffins were not sold at all. That's the truth. And the British Medical Journal has written a beautiful editorial. Doctors going on strike will definitely improve society's health. Now, somebody said, okay, we have more doctors, there will be less problems. There is no link between the size of the doctors and the health of society. As a matter of fact, the largest number of doctors are in Italy, and the lowest is in Japan. And the health-wise, Japan is the best, Italy is the last among the 14 industrialist countries seen. Now, Dr. Larry Dossey was telling about the checkups. Now, see this prospective study. It's a very beautiful study. 5,000 people were divided into 2 matched groups, and one group was checked up every 3 months religiously at free costs. And the other group was told, do what you like. And at the end of 5 years, there was hardly any difference between the death rate in the 2 groups. After 10 years, the intervened group had twice the death rate due to all diseases. At the end of 20 years, 3 times more people died in the intervened group, where every parameter, so-called parameter, was corrected by the doctors. The others didn't do anything. Next. Now, a lot of people say if your blood pressure is slightly on the higher side, as a matter of fact, now they are bringing it down and down and down. It was 160 by 110. It has come to now 110 by 75. And that's supposed to be the normal now. Now, look at that. For the first 3 years, nothing happens to you. Beyond that, beautifully treated people have 3 times more death and complications than people who have not taken drugs and compared to their normotensive cousins in society. Now, very new concept has come in. This is a very important thing which Dr. Dossey was talking about, the multiple sclerosis concept. The whole group of diseases called the autoimmune diseases. That is, your own body cells think you are foreign and try to attack you. This is called the concept of horror autotoxicus. Paul Ehrlich, 2 centuries ago, said, my God, what happens if the antibodies attack you? And now they think the antibodies attack you because you have the self and non-self concept. You become so selfish, you cocoon yourself and think everything else is different. No, the real concept is all are mine. This is exactly what Ayurveda says. Aptopasevi bhavet arogyam. If you treat everyone in this whole world as your near and dear ones, health will be yours for the asking. And what spoils health? Krodha, shoka, bhaya, ayasa, viruddhanna bhojana, taponalan, katva, amla, kshara, lavana, tikshprasthati, raktapitta prakopet. Hatred, jealousy, greed, anger, pride. And all these things kill you. And they kill you very, very seriously and badly. Now we know the most important risk factor for heart attacks is hostility, destructive hostility. Even students in Johns Hopkins, young students, were given a hostility score diary and every 3 months scanned with the PET scanner, and they found higher the hostility score, the quicker the damage to the coronary vessels. As young as 18 years. You would be surprised, American soldiers in the Vietnam War, 100 of them after death they were scanned, and they found 76% of them had 3-vessel disease. Their age was 22, average age. Antibiotics have done so much of havoc that in Britain now, we prescribe maggots for wounds healing. Maggots are given, cultured maggots in packets. Patient's wound is healed up, and then he said, go home every day, put maggots on that. Third day, the wound has healed. Gangrene treatment. Now, the multiple drug resistant germs have become so dangerous that many hospitals have to close down their operation theaters because they can't operate. These germs cannot be killed by the 500 molecules of antibiotics. Antibiotics are anti-nature. You try to kill a germ, the germ mutates. And we are back to the basics. Now see, work done in this country has shown that ginger and garlic put together are the most powerful antiviral drugs. Honey, locally and inside, beautiful drug. Indian spices like pepper probably is the best thing. After 50 years of research in the Colindale Cold Research Center, the last paper before they closed down the center said, for cold, we cannot do any improvement. Go and eat Indian spices. The future is for integrated medicine. And leave the well alone. Don't interfere. You know, Hutchison was a great physician of the last century who said, God, give me deliverance from A, treating human beings as cases. B, making my intervention worse than his disease. And 3, not letting the well alone. Yoga and health. Probably somebody will talk more about it. Power of prayer. Dr. Dossi has already. And never predict the future. Never predict the future of your patient. Thank you. So thank you very much for a very patient hearing.